Please be seated.
Ladies and gentlemen, you're very welcome to the Royal College of Physicians of Ireland for the membership conferring ceremony this afternoon. A special warm welcome to those who've travelled from Dubai and from the Middle East, where we again sat an obstetrics and gynecology exam in November 2020. You're very, very welcome here today, because when you look around today, you can get a sense of the history of the College of Physicians, a college that was first founded in 1654. And with the help of the Keeper of Collections, we've picked out a couple of historical facts, specifically for paediatrics, obstetrics and gynecology. I'm an obstetrician, so I'm going to start with the obstetrics facts. People who work in neonatology and people who work in obstetrics, we work very closely with our midwifery colleagues. So the first licentiate in midwifery was 1697 to Mrs. Cormack. For 150 years, you could not practice as an obstetrician and a physician together because it was considered in medicine to be beneath the dignity of the profession to be an obstetrician. Thankfully, that's now changed. And setting a standard for the obstetrics trainees who are sitting here today, there have been more presidents of the College of Physicians from obstetrics background than from any other profession. And that's also setting a standard that we hope that paediatrics will rise to. Because a common theme in all these memberships exams is that this is a significant step in your career and that we want you to join in. So we're setting the standard very high. We want you, in 15 or 20 years' time, to be up here on the panel with us. Or maybe not with us, maybe by that time we'll have retired. From a paediatric point of view, this is, of course, the College of Kathleen Lynn, the hero of the 1916 Rising, who set up St. Ultan's and set a standard for paediatric care that we still aspire to. It's also the College of Henry Marsh, whose I can't remember the words, the statue is sitting outside where you're going to be having a reception. He founded the National Children's Hospital in his own home in 1821, which then went on to become Harcourt Street and now is setting the standard for Children's Health Ireland. Sinead, and Louise, I hope I'm right in that fact. He apparently wanted to be a surgeon first, but he cut his finger in doing a dissection, and it being in those days, he got an infection and had to have his finger amputated because he would get gangrene. Happily, in his statue that's out in the hall, you'll find that his finger has now been restored to him. But a loss to surgery, but a massive benefit to paediatrics. In more recent history, we have more women coming into the college, and particularly we'd like to thank our president, Mary Horgan, who's an infectious diseases consultant, and all of us who've worked in the speciality and in medical care over the last couple of years in the pandemic will appreciate how appropriate it was to have an infectious diseases consultant as our president. And Mary's fantastic portrait, which was unveiled by the Taoiseach a couple of months ago, is in the corridor as you'll leave here today. We also have another female portrait, that of Laura Brennan. Laura Brennan was an amazing person who died a couple of years ago, and she was an advocate for HPV vaccines. So again, an area that hits all of us. It hits infectious diseases because it's a disease that's caused, cervical cancer is a disease that's caused by a virus. It hits paediatrics because who better than paediatrics to be talking about the values of vaccines? And we learned so much from paediatrics about how to counsel people of vaccine hesitancy. And it's a specialty for obstetrics, where we thank Laura Brennan for all the work she's done. So hopefully we'll see less cervical cancer and less complications from the treatment of cervical cancer. So before declaring the ceremony of the Royal College of Physicians of Ireland for membership open, may I introduce the platform party. We have Professor Timothy O'Brien, who's a fellow, Dr. Louise Kine, who's Dean of the Faculty of Paediatrics, Prof. Sam Coulter-Smith, the new Chair of the Institute of Obstetrics and Gynecology, Dr. Sinead Murphy, Chair of the Academic Board and Director of Education and Academic Programmes. It's not a very qualified people, isn't there? Dr. Maeve Skelly, who's Treasurer, and I'm Mary Higgins, and I'm the Vice President of the College. This is a meeting of the Royal College of Physicians for the purpose of conferring membership, which I will now declare open. With your permission, President, I will now proceed with the conferring ceremony.
Please proceed.
I will now ask all licentiatures and members to stand and read with me the declaration for membership. So please stand. We're going to start off by saying I, and then you're going to say your own name. So I do hereby solemnly, together please, do hereby solemnly and sincerely promise that I will observe and obey the statutes, bylaws and regulations of this college relating to members, and will submit to some penalties as may be lawfully imposed for any neglect or infringement of them, including erasure of my name from the list of members and the surrender of my diploma of membership received from the college. I further promise and declare that I will, to the best of my ability, do all things in the practice of my profession for the honour of the college and the good of the public. I further promise and declare I will not keep open shop for the sale of medicines, or endeavour to obtain practice or to attract public notice by any unworthy means, nor will I either permit or sanction the use of my name by any other person for such promise or in connection with any secret remedy. And in the case of any doubt relative to the true meaning of this engagement, I promise to submit to the judgment of the college. It really is a declaration that shows the history of our college, isn't it? So I now call on the President, Prof. Mary Horgan, to formally admit the new members of the college to membership.
I will now formally admit the new members of the college to membership. By virtue of the authority vested in me as President, I hereby admit you collectively as licentiates and members of the Royal College of Physicians of Ireland. Congratulations to you all.
I will now ask each new member to come forward and to receive your parchment as your name is called. Please sit until you're coming. And I apologise if I mispronounce names. Tabassum Aman. Barbara Elizabeth Burke. Neil John Collins. Aoife Corcoran. Jamal Dakil. Sarah Donoghue. Hannah Dunn. Tiernan Fallon Verbruggen. Daniel Gourlay. Shazia Gul. Ikia Guwali. Niamh Mary Haughey. Sive Hennigan. Samuel Hunter. Ikwa Adriz. M. Amala Jain. Basima Jamal Adin. Naomi Rosa Keenan. Sinead Lally. Hisham Hamad Saeed Logman. Leah Mora Loughlin. Nazreen Binti Midsharoom. Molly McClare. Circa Mullen. Aisling Nocton. Arif Unisa. Ciara O'Neill. Stephen O'Brien. Rebecca Laura O'Sullivan. Saima Naveen Rahan. Ciara Ryan. Kevin Slater. David Sinnott. Camilla Thorby. Sarah Whelan. And Paul Gerard Woolley. Our representative from the Trainees Committee isn't here today, so in their stead, Dr. Maeve Skelly, Treasurer of the College, will give a brief address.
Thank you. Presidents, fellows and members, it's with sincere pleasure that I'm here today to congratulate you on the massive achievement of succeeding membership of this college. I'm personally aware of the hours and months and years of work you've put into today. It's the culmination of a lot of sacrifices, personal and financial. You've made a lot of effort, and today your effort has paid off, and you must be justly proud. As members of the Royal College of Physicians of Ireland, you've distinguished yourself as the brightest and best physicians of your generation. You stand apart as a group of doctors who lead the profession for the generation to come. The pandemic has shown us, surely more than anything, we're at a turning point in how healthcare can and should be delivered to the people of Ireland. All of you graduating today have a command, a responsibility, an onus and an honour from the profession to work in serving and trying to plan how best we meet the health needs of our country. Your graduation today leads you one step closer to specialising in your chosen area and hopefully to becoming a leader in our healthcare service. It's a significant milestone in your career progression and your success. It also shows a new responsibility you have, particularly to younger colleagues, a responsibility to use talents and skills you've proven through challenge and adversity to teach and guide those coming behind you, to help them achieve and maintain the same high standards of clinical and academic excellence that you yourself have demonstrated. You know that the exams aren't easy, and many of you were severely tested to your limit, but you know that they're a goal worth achieving, a step on the road, so please guide your fellow doctors as they come along to get the same level of success that you now so deservedly enjoy. I'm well aware that nobody passes these exams without sacrifice and without help from family and friends. And I'm delighted to see that so many of you are here with that family and friends today, and that we're back together in person. It's been a long time in the college since we've had joyful events like this, and it really feels good to get back and see you here enjoying the success of your labours. The support you got was in no small measure, and I'm glad that they're here to share with you. My own exams are a long way behind me, but I don't forget the complex relationship that exams engender with the college. But your path to success isn't easy. I won't tell the stories now, but mine certainly wasn't. Thank you for your diligence, your perseverance, your professionalism. You have prevailed. If I can take a moment more of your time to say the exams are over, but I really hope that's not the end of your relationship with the college. It's a time of reflection. You're planning what you're doing, where you go, where your career will take you. I'd like to think that you'll remember the college, see the value of having an ongoing relationship with us, perhaps join the trainees committee. Through your experience of exams and training, you've seen things we do well, and you've seen things that we could do better. You've got ideas about how your profession should develop, and the college is the vehicle, the mechanism to help you drive forward that change. I'd urge you to stay in contact with us, help us to make the college a better place for trainees, so that you can continue to be proud of your association with the institution, proud of the fact that we're receiving and providing world-class medical training, proud of the fact that we're always looking to improve, to do better, to lift each other up, proud of the fact that we here in the room are working constantly to help safeguard the healthcare of the people of Ireland. Thank you very much. Congratulations and enjoy.
I will now call on the President, Prof. Mary Horgan, to address you.
Thank you very much, Mary. Guests, new members, fellows, it's a particular pleasure to welcome you all here today. This is the first week we've had conferring since December 2019, and we all know what happened between then and now in that intervening 2.5-year period. But what I can say is that science and Ireland's belief in science has brought us to where we are today, being able to come together as a college. And the college isn't a building, it's the members and fellows in the college that make up our college. And I suppose I'll put how good the science is into context. So when I was a medical student in UCD in the early 1980s, AIDS was first described in 1981, and it took 4 years to develop a test to identify those that were HIV positive. With SARS-CoV-2, the virus that causes COVID-19, it took less than 4 weeks to develop a test. And that's because we had a common enemy, a huge investment by governments. And indeed, what we're looking at here is the future generation of medical people, scientists, innovators who've led us to where we are today. Being a doctor isn't just about caring for the one patient in front of you. It's about taking on leadership roles that many of us within the college did. And I'll reflect back as an infectious disease doctor in the specialty for 30 years, going on the wards in March 2020, and really being, a little afraid, probably is an understatement. We didn't know how it was transmitted. Would we get it? Would we end up sick? Would we bring it back to our families or not? But what we did have was a common purpose, which was ensuring that we looked after our patients. So we did what we always do, rolled up our sleeves and got on with it. And I remember Karina Butler, who you'll know is chair of NIAC at the time, she says, gosh, we just are not seeing this in paediatrics at all. But of course, subsequently, we were seeing it, so it really affected everybody. And really to acknowledge the people in obstetrics in this country, they were the first in the world to identify a condition called placentitis, which is inflammation of the placenta that led to or leads to miscarriage. And I think there was a bit of I suppose, skepticism in the beginning from neighbouring countries, put it that way, saying, well, sure, the Irish couldn't see these kind of things, but, you know, we're really good clinicians and we really observe what's happening on the front line because we have contact with our patients. So our obstetricians stood out globally in their observation of a totally new condition in a new disease. And I suppose talking to you as new members, it is really important to get involved in the college, get involved in committees, management, because at the end, you're the people who have to take on leadership roles, as many of us did on the NEFIT and NIAC and rolling out rapid testing within the country. The people at the back of the room depend on the people in the front of the room to ensure that our healthcare system is fit for purpose and delivers the best care that we possibly can. I suppose we are used to working as teams in hospitals, but being a doctor is also about the support of the people in the back of the room, and that's not just financial, but it's the psychological support, the support when the going gets tough that they give you, the cups of tea, the keeping the kids quiet when you're doing exams. You don't get here by yourself, you get here because of the support you've always had from families and friends, and that can't be understated. So a warm thanks to everyone at the back of the room. I was in your place 34 years ago now, I can say a number of years, in 1988, and little did I think that I'd be the first woman president of the College of Physicians, or indeed the first Kerry person to be president here. And my advice to you really is follow your dream. Be ambitious in your plans. There'll be twists and turns on your road to get where you are, but you know, there'll be challenges, there'll be failures. We learn from our failures, but do follow that dream and don't be undeterred with all the twists and turns that come on the way. To get you here, we have an exams board to ensure the highest quality for those exams, and that's why they are recognised globally. Particular thanks to Professor Mary Higgins, who leads out in the obstetrics, along with Dr. Nikki Pundari, Ciara MacDonald, and I know there's one, Paul Byrne, who with our staff within the college, and I say Colm Small and Sinead Freeman, ensure that they are delivered and that you get to where you are today. So just to acknowledge their work. So just hearty congratulations from everyone in the College of Physicians. Really the best of luck in your future careers. No doubt we'll be seeing you again. Do get involved in the college. You can't give out about the college unless you're involved in it. It's great to see so many younger people getting involved in it. So, and particularly obstetrics and paediatrics have always been very involved in the college. So enjoy the rest of your day and all the best in your future careers.
So that completes the conferring ceremony for membership. We'll ask guests to remain in the Corrigan Hall while the group photograph for new members, congratulations, takes place in the main entrance hall, and a reception will follow the group photograph in the Graves Hall, which is the middle hall. So we'll ask, will all rise?